have here with us today Dr. Shilpa Sood, who has performed wonderfully in the NEET SS exam. Her rank is 18th, and she has been allotted IGIMS Patna for MCH in reproductive medicine and surgery. So let's hear it from Dr. Shilpa. We'll first listen to a little about herself, and then she'll tell us her strategy, how she secured such wonderful marks and such a wonderful rank in the exam. So Dr. Shilpa, first tell me more about yourself, and then we'll go ahead with your strategy for the exam.
Very good afternoon, ma'am. Before starting, I would like to thank you a lot for starting Reproductive because it really helped me a lot.
That's
I was just out of touch from so many things. So much of the syllabus I was out of touch, but your material, your hard work, ma'am, your hard work just helped us out. Lots of us, it helped us out.
Those are very kind words from your side. It was a lot of hard work from your side, definitely.
Yes, ma'am. As you always said that it is maybe 5% mine and 95% is yours, but ma'am, it is equal. Malab, your hard work is I can't express in words. It helped me so much. I can see you just gave us so much of material which was already prepared. We had to just go through the notes, and your lectures are so helpful. The test series, it is so good.
Thank you.
The words are less for me.
You were being very kind to me. Of course, it was your hard work, especially with the toddler. You were putting her to sleep before we started the video. So this is also a beautiful story that I want to listen to. How did you do it with a 3.5-year-old daughter?
Ma'am, I'm a passed out. I'm a post MS. I cleared MS from IGIMS Shimla in 2016, and then I joined SRship in Lady Harding, Delhi. Then I completed 3 years of SRship. So after completing SRship, during SRship also, I had this desire to join some super specialty, maybe fellowship or something like that. So, but with a child, I could not just get time to sit and prepare. But this Corona period, it was really very, it was a blessing for me.
Blessing
so,
is for you.
Yes, ma'am. So I could sit and prepare with my daughter. She was running around. I was just going through the syllabus. So it was really a tough time, but your material, ma'am, is excellent. It is excellent.
So the delay in exam because of Corona helped you a lot. This has been common with all the students. They're saying we were preparing and then we decided we'll prepare with more efforts because the exam was delayed and we thought we'd stand a better chance. So you also thought you stand a better chance because it was delayed.
It was delayed, ma'am, because earlier I was preparing. I read Sparrow and
this is one important question which I've been asking all my students. How much of the big books have you read?
Yes, ma'am. All the big books. As Williams, I had already read when I was doing SRship, and during 2020, I read it thoroughly. Then in April, I started with the Spirov because I'd read it in the PG time. Little material was there in the book. It was just some pages I had read at that time during the PG time. Now I had got some time, so I started reading Spirov. It is a very nice book, ma'am. So many concepts.
This is also a common answer. Anyone who's taking reproductive medicine, they have at least read the book and loved the book Spirov.
Yes, ma'am. It clears so many concepts, and your notes are. There are so many points from. Well, every page I can find.
Yes, I have covered most of the basics notes from Spirov only, and the rest from the latest guidelines.
So this Spirov also propelled me that I had little inclination towards reproductive medicine.
That was the same story with me. I loved this book during my PG times, and that is how I thought that let's do more in reproductive medicine.
Reproductive medicine. This book helped me a lot, ma'am, and your material. I would say again and again because I read it so many times, ma'am. I had read it so many times.
That's nice. I'm feeling very proud of the, very good bunch of students that I have got who read the study material, who made use of it.
Yes, ma'am. Ma'am, it was a blessing for me and for many students like me who were preparing. I was just going through which I had to join. Like there were many online coachings, and I just hinted upon this repro NEET. So I just clicked on and I joined the test series in April. And then when I went through the test series, I thought maybe I should take the lectures also. Then I took the lectures also, the videos and all those things. And it really helped me a lot.
Okay. It has been lucky for you and for me also that you took the coaching at Reproductive Learning.
So we are blessed, yes, ma'am. Ma'am, and you kept us so updated with so many things, like the ESHRE guidelines, the ASRM. Yes, ma'am. Yes, ma'am. And even the Corona, you taught it thoroughly.
Yes, I taught Corona, but there were not many questions. But at least I did my part of teaching.
When I used to sleep at night, then I used to listen to all your lectures. I used to revise all your lectures. Like with the topic I had read in the day, I used to revise it at night before sleeping through your lectures. So I had listened to your lectures.
You were consistent through your preparation. Despite taking care of a toddler, you did make a point that you were going to be consistent.
Yes, ma'am. For 4 or 5 months at least, I was very consistent.
So this brings to the next question. When did you seriously start preparing for NEET SS? When did you decide you'll do and when you started preparing?
Ma'am, it was actually after April 2021 that I decided that I have to give the exam, because I gave in 2020, but I was not very prepared. It was just 1 month of preparation.
Okay.
So I thought in 2021 I will give it a try. So I started after April with the Repro NEET. And then the books followed that I have to read.
Read the books, then the lectures were easy for you because you had already read the books.
Yes,
so that's also an important point for students, that of course the class notes are complete, but you have to have a basis with books like Spiro.
Yes,
tell me about oncology preparation. Since you are into reproductive medicine and the NEET SS paper is clubbed, you have to read oncology also as much as anyone aspiring for oncology.
Yes, ma'am. Then I prepared it from the Barrack and Hacker, as you had told that it is just a book which is sufficient for you to prepare, and you should read it line by line. Just remember it line by line. So the chapters I read from your notes, the books, and then I made my notes also.
Okay.
So this way I read. Barrack and Hacker thoroughly I read, but some chapters I had left, like exentrations and the surgeries.
I know the last few chapters are very difficult. It gets tiring after those.
Laparoscopy, yes, ma'am. And for laparoscopy, endoscopy, I relied on your notes, your question bank.
We had 3-4 classes on laparoscopy, endoscopy.
Yes, ma'am. That was very helpful, ma'am.
Okay. That's nice. For OBGY, tell me especially, what did you do?
Ma'am, I had read the Williams, the previous edition in 2020. Then the new edition, I read both the editions.
Okay, so you read Williams obstetrics. Yes, and then what else did you do? The guidelines, ACOG, GTG, which ones did you rely
on? Ma'am, the guidelines you had given us, plus the notes I had made from the guidelines, because you said you read them once and you make notes from them, because you won't be able to recollect every guideline. So like I was reading gestational hypertension, so I searched the topic and I made from the recent topic what is there. Like in ACOG, all the 2020 topics, 21 topics, I searched and I made notes, ma'am.
So you have done a very disciplined way of studying. I can see you read everything, you made beautiful notes, and in the end they helped you.
Yes, ma'am. Then I revised. I used to revise the notes, ma'am.
Right. It is an ideal way of preparation, I would say.
Ma'am, because with a kid, it becomes a little difficult, because I have to keep on, like I was handling her and then I was going through my notes.
So such discipline with a toddler at home is definitely commendable, definitely appreciable. I'm so proud of you, Dr. Shilpa.
Thank you, ma'am. Thank you so much.
Now tell me, last 1 month, this is also an important advice to give to students. Last 1 month, what all did you read?
Ma'am, I did not read any new things. I was just concentrating on what I had read previously. Like I had made notes, I used to revise those notes thoroughly. Like I had kept days, like in 7 days, I had to go through this. Like in 14 days, I had to revise these many topics. And then again, I will revise, because
you already pre-planned everything.
Yes, ma'am. I was
last month. You were knowing what all you will read in what many days.
Yes, ma'am. And the classifications. Yes, ma'am. And the classifications of cancers, like in PG time, we used to make small notes, and we will put on wall, and I will just go through them again and again because we forget.
It's so nice to talk with you. You were determined, you were disciplined. It is, I feel fortunate to meet such beautiful people, such brilliant people. I learned the ways you tell me how you've been preparing. So it's nice to talk to toppers. Your way of preparation, I'm just loving your way of preparation, your determination, your discipline, sticking notes on the wall. So you knew that you had to do it.
Yes, ma'am. I was trying for it because I got some fellowships from some places. Kamini Rao ma'am's fellowship was there for 18 months, but I left it. I thought maybe I should give a try for NEET SS. Then in AIMS, I appeared for a fetal medicine fellowship, ma'am. Written I cleared, and I was in waiting in interview. So again, it was a big this thing that I have to do it.
Okay, so this time you had to do it.
I had to do it.
Okay. And one small question: how did you approach the exam? It was a negative marking exam. How many questions you did not attempt, and how did you decide?
Ma'am, like everybody, when you are sure of some answers and options and the question, you will attempt 100%. But where the things are dicey, like then you have to like some things we remember by concept, something we mug up the things.
If you're
And
able
if
to
I'm
rule out a few
yes,
options,
ma'am, yes, ma'am, yes, ma'am.
then
If
you
you are able to rule out, then I'll mark. Otherwise, there was a negative marking. But yes, it is a very competitive exam, so you have to attempt on the higher side, ma'am.
okay.
So I attempted at least 93 questions in NEET assessment.
So this is different from what I'm getting from other students. Other students left up to 5 questions, but I think you are a very disciplined kind of a person. You knew which all answers you're sure about, and you knew which all answers you will not mark.
Yes, ma'am.
And
Yes,
that's
ma'am.
how you've been able to manage. And so your preparation was quite thorough, I can say.
Ma'am, yes, ma'am. I was thinking maybe this is my last chance of preparation, so I had to give it my best. I have to give it my best, and rest I've left, ma'am, all the things.
Right. And the marks, I think 40 marks range, there's not much difference in the preparation of students. It is mere luck because each question
Yes,
gives you 4 marks.
yes,
And one wrong gives you 1 marks minus. So for
yes,
this difference of 290 to 325, I
yes,
don't consider much difference between the students that have secured any marks in between. So wonderful way of preparing. Yes, Dr. Shilpa, tell me.
nothing. I was just saying that if you are confident enough that
Yes.
this you are able to rule out the wrong options, then you should 100% attempt. But if you are dicey on anything, then you should not attempt, because if you mark one wrong, then that will give you, I think, maybe 2, 3, 4, how many ranks it will take
Yes.
you down, you don't know.
One negative marking can also take your rank
Yes,
down.
ma'am.
That's
Yes,
right. So it's a competitive exam plus negative marking makes it more competitive.
yes, ma'am. Yes, ma'am.
Well, it was wonderful talking with you. One last question: how did you decide? When did you decide that it's going to be reproductive medicine and not oncology?
Ma'am, I don't have much of the my experience with the oncology patients. Like most of it was in the PG time, some of it was in the SRship time. But when I read Spearoff and your lectures, that gave me an inclination towards reproductive
Your
medicine.
interest.
Yes, ma'am.
It was your interest that you decided you will take it.
Yes, ma'am. Yes, ma'am. It was my later on the interest.
Now, students should take a point of this, that the strategy of all the toppers is almost the same. They are all disciplined. The last 1 month, everyone is saying, read that, don't read anything new. Just revise everything and go through the notes. Keep going through the notes. Be disciplined. So lovely talking with you, Dr. Shilpa.
Thank you, ma'am. Same here.
Free to go back to your toddler who's waiting for you. I would love to meet her.
She might be asleep.
No. Be asleep by now. So maybe you relax now. Right. And I'll see you here in Patna.